Coding Credentialing Organization by AAPC. AAPC is the world's largest training and credentialing organization for the business of healthcare, with more than 175,000 members worldwide who work in medical coding, medical billing, clinical documentation improvement, medical auditing, healthcare compliance, revenue cycle management, and practice management. CPC, Certified Professional Coder. The most recognized medical coding certification in the healthcare industry. The CPC is the gold standard for medical coding in both hospitals and physician practices. Eligibility requirements: diploma or any degree. Exam specifications: 150 multiple choice question. Time: 5 hours and 40 minutes. Pass score: 70 out of 100%, in which we should ensure more than 105 questions should be answered correctly, out of 150 questions. Exam fee: $380 for non-AAPC student, $300 for AAPC students. And also, you will get one free retake. CPC Certification Syllabus. To know more about this CPC certification syllabus, please look into our first CPC lesson. To watch that first lesson, please check in this video description, or directly click our channel icon. In this CPC certification syllabus, today we are going to learn anesthesia services. Let's see. First we see what is mean by anesthesia and how it works. The anesthetic drug is injected near a cluster of nerves, which helps to numbing or unsense the body part during the procedure. The anesthesia is classified into local anesthesia, regional anesthesia, general anesthesia and moderate sedation. The code ranges it start from 0000 to 01999, in which we may expect to get some around 8 questions in CPC exam. It's very easiest topic, based on the following 4 main criteria, in which we can answer most of the question, even without referring book also. 1. Physical status modifiers, P1, P2, P3, P4, P5 and P6. 2. Qualifying circumstances, Addon Codes. 3. Identify whether the anesthesia procedure is performed by an anesthesiologist, or certified registered nurse anesthetist, or surgeon. 4. Time reporting. First we see about physical status modifiers, in which there are 6 modifiers are there. They are: 1. P1 modifier, which denotes for a normal healthy patient. Example: healthy, non-smoker, without or minimal alcohol use. 2. P2 modifier, which denotes for a patient with mild systemic disease. Example: well-controlled hypertension or diabetes, mild depression, smoker, obesity, BMI less than 40. 3. P3 modifier, which denotes for a patient with severe systemic disease. Example: uncontrolled hypertension or diabetes, morbid obesity and history of myocardial infarction, cerebrovascular accident or TIA, pulmonary embolism, ESRD undergoing regular scheduled dialysis. 4. P4 modifier, which denotes for a patient with severe systemic disease that is a constant threat to life. Example: sepsis, myocardial infarction, cerebrovascular accident or trans-ischemic disease, ESRD not undergoing regular scheduled dialysis. 5. P5 modifier, which denotes for a moribund patient who is not expected to survive without the operation. Example: multiple organ dysfunction or failure, ruptured aneurysm, intracranial bleed with mass effect. 6. P6 modifier, which denotes for a declared brain dead patient whose organs are being removed for donor purposes. Let's see some examples for better understanding. Example number 1. What physical status modifier should coders append to describe a patient with uncontrolled DM? Guess it, what will be the answer? Yes, correct. The answer is P3. Because the uncontrolled term which belongs to severe systemic disease. Let's see the example number 2. What physical status modifier should coders append to describe a 23 years old patient having COPD? Guess it, what will be the answer? Yes, correct. The answer is P2. Because the patient having mild systemic disease as COPD. Let's see the example number 3. The patient fall from 3rd floor, he dead while bring him in ambulance. Now his organ was removed for donor purpose. What physical status modifier should you use to report this? Guess it, what will be the answer? Yes, correct. The answer is P6. Because the patient who dead while bring him in ambulance, so his organs are being removed for donor purposes. Now we are going to see for second main criteria as Addon Codes, qualifying circumstances. The following codes should not use as primary CPT or stand alone. We must use this code with any primary CPT. The primary CPT ranges will be starts from 00100 to 01999. Let's see the list of Addon Codes. The first one is 99100, anesthesia for patient of extreme age, younger than 1 year and older than 70. Don't report 99100 in conjunction with the following codes. The codes are 00326, 00561, 00834, 00836. Because the code itself the age is included. 99116, anesthesia complicated by utilization of total body hypothermia, which denotes very low body temperature. 99135, anesthesia complicated by utilization of controlled hypotension, which denotes very low body blood pressure. 99140, anesthesia complicated by emergency condition. Emergency condition is defined as existing when delay in treatment of the patient would to a significant increase in the threat to life or body part. Let's see some examples for better understanding. Example 1. Lower abdomen wall hernia repair was done for 70 years old patient. How did you report this services? Option A. 00830. B. 00830, 99100. C. 00834. D. 00834, 99100. You can use the below references to answer this questions. Guess it, what will be the answer? Yes, correct. The answer is option B. The codes are 00830, 99100. Example 2. Lower abdomen wall hernia repair was done for 3-month-old baby. How did you report this services? Option A. 00830. B. 00830, 99100. C. 00834. D. 00834, 99100. Guess it, what will be the answer? Yes, correct. The answer is option C. The codes are 00834. Now we are going to see for the third main criteria as identify whether the anesthesia procedure is performed by an anesthesiologist, or certified registered nurse anesthetist, or surgeon. Number 1. Surgeon versus anesthesiologist combination, where the anesthesia services is performed by an anesthesiologist. In this case, we need to report this anesthesia service by using the code range between 00100 to 01999 along with the procedure which done by surgeon. 2. Surgeon alone, where the anesthesia services is performed by surgeon itself. In this case we should not use the code range between 00100 to 01999, instead of that we should use the modifier 47 along with the procedure which done by surgeon. Number 3. Surgeon versus CRNA combination, where the anesthesia services is performed by certified registered nurse anesthetist. In this case we should use the modifier QY, QK, AD for surgeon, and QX, QZ for CRNA. Let's see the list of modifier for physician. Example. If 1 CRNA presents, we need to use modifier QY. If 2 to 4 CRNA presents, we need to use modifier QK. If beyond 4 CRNA presents, we need to use modifier AD. Let's see the list of modifier for CRNA. Example. If CRNA service is given under the medical direction by a physician means, we need to use the modifier as QX. If anesthesia service is directly given by CRNA itself, without of the medical direction by a physician means, we need to use the modifier as QZ. Let's see some examples for better understanding. Example 1. Ventral hernia repair was done for 70 years old patient, the anesthesia was given by anesthesiologist. How did you report this services? Option A. 00830 B. 00830, 99100 C. 49560 with modifier 47 D. 49560, 00830, 99100. You can use the below references to answer this questions. Guess it, what will be the answer? Yes, correct. The answer is option D, 49560, 00830, 99100. Example 2. Ventral hernia repair was done for 12 years old patient, the anesthesia was given by surgeon. How did you report this services? Option A. 00830 B. 00830, 99100 C. 49560 with modifier 47 D. 49560, 00830, 99100. Guess it, what will be the answer? Yes, correct. The answer is option C, 49560 with modifier 47. Example 3. Ventral hernia repair was done for 12 years old patient, the anesthesia was given by 3 CRNA under the direction by surgeon. How did you report this services? Option A. Surgeon with modifier QK B. Surgeon with modifier QK and CRNA with modifier QX C. Surgeon with modifier QK and CRNA with modifier QZ D. CRNA with modifier QZ. Guess it, what will be the answer? Yes, correct. The answer is option B, surgeon with modifier QK and CRNA with modifier QX. Now we are going to see for fourth main criteria as time reporting. Anesthesia time is defined as the period during which an anesthesia practitioner is present with the patient. It starts when the anesthesia practitioner begins to prepare the patient for anesthesia services in the operating room or an equivalent area. It ends when the anesthesia practitioner is no longer furnishing anesthesia services to the patient. Now we are going to see the last main criteria, but it's not a least. The topic is anesthesia for surgical, diagnostic and obstetric services in CPT code level. Here, we are going to see how to get correct CPT codes. It's really very easy, if you understood the following 2 tips. Let's see. 1. Under Anesthesia CPT section, all codes are categorized by anatomy basis. The example of it, we listed below. In which, based on more specificity, you need to report the CPT code. Example. Corneal transplant was done on right eye. Guess it, what will be the answer? Yes, correct. The answer is 00144. 2. If you are not able to find any definite code, you need to report not otherwise specified code based on anatomy specific code. Example. Cataract surgery was done on left eye. Guess it, what will be the answer? Yes, correct. The answer is 00140. Because there is no specific code to report this cataract surgery. Thus the reason, we need to lead the code as other specified based on anatomic specific, not otherwise specified code should lead. PPMP Creative System. For more updates, please subscribe us. And also, your feedback is more valuable for us. Please comment your feedback or any suggestion, or if you want any more clarification also. Thank you for watching. Stay connected with us for more updates. See you on our next video, where we will see with more informative and interesting topics.